Let's go to the slides. Eric, we'll start with our regular data slide. If we look at the number of cases, 1121, what we know, of course, is during the weekend, particularly a holiday weekend, these numbers were down. They're back up now, 1,100. Deaths, and I would just remind people, because we have questions about the deaths, and people look at these numbers, and with the deaths, what we're doing is simply reporting the number that we have reported that day. Then for the full data, it may have been 5 days ago, 10 days ago. Those are slotted in for those days. But the number you're seeing here is what has been reported in that last 24 hours. So Eric, let's take a look at the next one. Well, this is, an advisory, and we put this up only as an advisory. We do it once a week. We do it on Wednesday. It is posted, and what you'll see on here are the states that we, advise that if you're going to be traveling to, just understand that the positivity rate is particularly high. All these are actually 18, with the exception of North Dakota, that is at 19 positivity. That is a high positivity. So the advisory is for leisure and business travel. We ask that it be followed by Ohioans and out-of-state travelers. This week, 4 states have a positivity rate of 15% or higher: North Dakota, South Dakota, Kansas, and Alabama. So again, we just advise people, if you're going, understand that that's a high rate. As we discussed, it's not always just about where you're going. That's part of it, but it's also about what you do when you were there. Okay, let's look at, Eric, the case numbers by age. This is a slide that our team has put together, and it starts off in March, and you see percentage of cases, and then into September. And as you can see, as far as cases, this first group, 0 to 19, is the first line, and 20 to 29. So if you look at in September, now we're in a partial month. We don't obviously have the full data for September. We're a long way from that. But if you just look at the days so far in September, significant number of cases, 56 or so cases, that are between the age of 0 and 29 as a percentage. So again, these numbers, if you look at August, which is a complete month, which is probably a better month to look at, 0 to 19, it's 16% the cases made up of that group of people, 22% the age of 20 to 29. So again, these are going up. They've kind of stabilized now. But again, it's just interesting to see where these cases are. Eric, you want to pull the next slide? This is hospitalization by age group. So you take each age group, and what you look at is the percentage of those people who got COVID, who tested positive. Those people who got COVID, how many of them ended up in the hospital? And so no real surprise. One caution, this is not 100%. This is only up to 30%. So, obviously the top groups that end up in the hospital are the older individuals, but also note the youngest. So the youngest 5%, 0 to 4, 5% of them ended up in a hospital, and up to 30, a little bit better than 30% in the 80 to down to 70. So again, no huge surprises, sort of the things we've been saying, but this is Ohio data, and this tells you kind of what we are seeing in Ohio. Eric, let's go to the county color update. And a lot of this is stabilized, for good or bad. 68 of our counties stay at the same level this week. 9 counties dropped from orange to yellow, so more yellow counties. We like that a lot. Great improvement. Lucas County, Wayne County dropped from red to orange. Again, we're happy about that. We have 6 red counties, tier 3. That's down from 7 last week. This week's red counties: Butler, Mercer, Montgomery, Preble, Putnam, and Summit County. 2 of these 6 counties, Mercer and Preble, only meet the CDC's threshold for high incidence, but because they were already there, they stay there. We'll talk more about those in just a moment. Let's talk now about the red counties. Let's start with Putnam County. Putnam County is at a high level of cases, 280 cases per 100,000 population. Putnam County has had 95 cases during the past 2 weeks. The county's total since the beginning of the pandemic is 430 cases. So you can see they're getting a lot of them in a rush. County is seeing a sustained increase in new cases, growing from an average of 5 cases per day on August 19th to an average of 11 cases on August 29th. Primary source of spread in Putnam County is within families. For example, mom gets it and then comes home and gives it to other family members, or dad gets it, or child gets it, but it's in families, basically spread within the community. Let's go down to Butler County. Butler County's numbers certainly are still being influenced by what's going on at Miami University. Between September 2nd between September 2nd and 8th, there were 545 student positive cases. The previous week, there were 495 cases. These numbers are certainly impacting the county's sustained increase in new cases. In addition to the Miami University student cases, there are small outbreaks at workplaces and long-term care facilities. Let's go up northwest Ohio to Mercer County. Mercer County continues as red because they meet the CDC's threshold for high incidence. Their number is 206 cases per 100,000. Their per case number sadly increased this past week from 179 last week to 206 this week. So we'd seen it coming down for Mercer County for a couple of weeks. Now we're seeing it starting to go back up, still at a very high level. Mercer County continues to see spread throughout the community. They've had outbreaks in workplaces, they've had long-term care facilities, and they've got just pretty much spread throughout the county. Montgomery County, one of our more urban counties. While during the total 2-week reporting period, Montgomery County had a sustained increase in new cases, the county is seeing a decline in cases during the most recent week of reporting. Remember, we look at 2 weeks always. So the last week has been better. We're seeing a lowering of cases coming out of the University of Dayton. During the past 3 days, they only had 31 cases. They have a total of 962 total recovered cases, so 962 recovered. UD has shifted their classes to remote through September 14th to slow the spread. In addition to the University of Dayton student cases, there continues to be small workplace spread and long-term care facility outbreaks as well. Over west there to Preble County, their case number is 105. So if they can get below 105 for a 2-week period, we hope that next week they will drop below the red. Preble County's cases have decreased during the past 3 weeks from an average of 146 cases to 122. The county is ending the past 2 weeks in an average of 105 cases. If the county continues on this trajectory, it should drop from red to orange next week. So again, most important part, they're moving in the right direction, and we hope that Preble can get that below 100 and move off the red. Summit County, seeing a sustained increase, sadly, in emergency department visits for COVID-like illness. That is an early warning sign. On August 20th, the county had an average of 5 visits per day to the emergency department. That number increased to an average of 9 visits per day by August 27th. The county also seeing a sustained increase in hospitalizations. Admission numbers have increased from 2 admissions on August 22nd to 7 on August 29th. Outbreaks have been associated with workplaces and a fraternal club. I want to take a minute and talk about the fraternal club outbreak. We're certainly not going to identify it, but like many of the clubs that are found throughout our state, nonprofit, has a restaurant, has a bar. In this case, 2 people visited the club while they were contagious. Since then, employees, other members, and family members got the virus. No indication, obviously, that these people who came knew that they were contagious. People don't most of the time know that. At least a lot of the time they don't know that. So again, 2 people came, they visited, and then we saw other members and family members get the virus. A total of 12 people tested positive. Only one of the people was with symptoms. The cases range in age from 29 to 81, and 4 people have been hospitalized, 2 are seriously ill. Look, we don't share these stories to make people feel bad. This is just a horrible, horrible situation. I don't think anyone wanted to make anyone sick. None of us want to make anyone sick, but the story just illustrates how this can happen in what would appear to be a very benign, friendly situation. So we just ask people to wear masks, keep the social distance, and do all the things that everyone talks about in the health community. Let's go, Eric, to our top 10 counties. Again, what this represents, and this is the top 10. You can see on our webpage the top 88, but we'll stay, Eric, just with the top 10. These are counties that, no matter what their color, meet the CDC's threshold of what they call high incidence, which means over 100 cases per 100,000 over a 2-week period of time. A county is flagged as high incidence when it has more than 100 cases per 100,000 residents over the past 2 weeks. CDC uses this as a definition of high incidence. Why do we worry about these counties? Well, it means that cases are rising steadily in a county. Even if that county doesn't meet one of our other indicators, they have a significant number of cases. Having a large number of cases can lead to rapid virus transmission throughout the county if steps aren't taken to slow the spread. 4 counties moved to a high incidence list this week, and I want to talk briefly about them. First is Clark County, Springfield area. Wittenberg University, located in Springfield, is certainly contributing to the increased number of cases. And again, we see this throughout the state with colleges as students are coming back. University is reporting on its dashboard, so anybody can go look at that. The cases have increased to more than 70 this week. These cases are being associated with out-of-class social gatherings. And again, that's a common theme as we've seen in our schools. To help combat the spread, the university announced on September 9th, the classes will be remote for 2 weeks. After several weeks of being below the high incident threshold, Hamilton County is back on the list, barely, but they are back, 103 cases per 100,000. The county has seen small outbreaks in high school, college, and workplace settings, along with other sources of community spread. The University of Cincinnati is reporting 143 cases in the past 15 days, which does contribute to that. In late August, Miami County had some small workplace and church outbreaks. This week, a nursing home outbreak was identified and already has more than a dozen cases. Miami County is 117 per 100,000 residents in the last 2 weeks. And then we'll go up northwest Ohio again, clear up to Wood County. During the past 2 weeks, they've had 144 positive cases. Bowling Green State University has a newly developed COVID dashboard, so you can take a look at that. That reports that Bowling Green had 62 cases, Bowling Green State University, 62 cases from September 1 to September 8th. And that's the numbers.